Marissa Walster, Vice President of Financial Services here at the Financial Health Network. And I am honored to be on stage today with Holly O'Neill, President of Retail Banking at Bank of America.
Yeah, it's nice to be here, Marissa. Thanks for having me.
Yeah. So Holly, you lead a business that serves over 30 million consumers across a wide range of financial products and digital tools, which means you have a pretty tremendous view into consumers and how they're managing their money. And so I'd love to start by hearing, what are you seeing today and how are people managing through tough economic times?
Sure, so we do see quite a bit coming through our client base. And while the retail business is 30 million clients, we really look at the data across 60 plus million clients. So it is a fairly good sample size. So I'll tell you what we see, and we've been watching this for quite a while. The consumer is still quite strong, and I know that that conflicts a little bit with what we read and hear around sentiment generally, because I think people are concerned. But when you look at the actual health of the consumer client based on what they do with Bank of America, they're very strong, and we look at it in a handful of categories: credit and debit spending and their payment behavior. So when you look at the consumer client, the month of August and September, they're spending at a higher rate than they were a year ago. So that would be number one, and it's up about 11% year over year. So that's a pretty healthy increase. Discretionary spending is up, so that's spending where they don't necessarily have to spend it, they're continuing to spend. So couple that with the balances in their accounts. So the amount of money they have in checking and savings, that's also very strong. And it's multiples of where it was pre-pandemic. So they've shifted behavior and they're maintaining healthy balances in their accounts. And that is across all income spectrums, right? And even at some of the lower levels of the income spectrum, they're actually even healthier and multiples higher than they were pre-pandemic. So spending is there. Their account balances, savings and checking is there. On the credit side, we are not seeing them borrow up. So they're still borrowing at a lower rate than what they were borrowing pre-pandemic. And we also see this in credit card data, right? They're still paying off credit cards at a very high clip, almost at historic highs, which is good from a consumer health perspective. So those are, three things that we look at very deeply. I've simplified it here. And then from a bank perspective, we're seeing record low delinquencies and charge-offs. So that's really the end result, but we're not seeing any troubling data or information coming through there either. So that says to me the consumer remains healthy. We do look at the data and we say, okay, so what happens if spending continues and the balance between inflows and outflows of their accounts shifts? They still have quite a bit of cushion, 5 to 6 months of cushion. So we look at that and say the consumer is relatively healthy. That being said, we know, there's some concern out there. Inflation is very high. Things are very expensive. So, that is certainly a countervailing point that I think consumers continue to wrestle with.
Well, it's good to hear that there's good signs, strong signs still. I'm always so impressed to hear how close you and your team are to consumers and their financial health and how much energy you spend on really looking at the data and understanding where they're at. Our organizations have been working together for some time now, and we've been learning how you have really crafted a whole customer experience that is grounded in financial health. And I'd love to hear a bit about the genesis of that work and why financial health is so important to Bank of America.
Sure. It's very simple. I'm going to start at the top. And our CEO, Brian Moynihan, talks about this all the time, the power of the and, right? Deliver for our shareholders and our communities. And and really be a good steward. So that's really where it starts. And Brian started that over a decade ago with a discussion at our company around responsible growth and what does that mean. And it really has just evolved from there. So that was really the genesis of it. And then from a consumer business perspective, where I spend my time, it's very simple. We have to partner with our clients in their success. In this case, it's their financial health, so that they continue to want to do business with us, right? So, and that is really driving a great foundation for our clients, a relationship banking model, where they feel like they have a partner in their financial health and their financial success. And that can take on a whole variety of flavors, right? Whether it's just starting your financial journey, or if you're more mature and advanced and have to start, saving for retirement and really preparing. So it definitely is personalized depending on who you are. And that is, what we're trying to achieve is across our company, create this foundation of financial health focus in the fabric of everything we do, right? And so in the consumer business at Bank of America, along with many of your organizations, that takes on, how we interact in our financial centers, in our digital properties, in our call centers, how we develop products. So, it really is across the fabric of what we do. We partnered with J.D. Power around the financial health certification. That helped us to formalize this fabric, and we continue, to do some work in this category, and I expect that we'll continue to do that. We've obviously had some extensive changes in our fee structure at the company, and I think we'll talk about that. And we've also spent a lot of time creating a collection of financial solutions that are simple, transparent, and low cost, right? And so we call those the essential solutions, but the goal there was just really to simplify how we're interacting, how we're presenting financial solutions to our clients so that it meets the needs of most.
That's great. I mean, financial health is a pretty broad concept, and at the Financial Health Network, we have a definition of it, but it can come to life in so many different ways in different organizations. What does financial health mean to Bank of America, and what are ways in which you're sort of driving it into action on a daily basis?
Sure. So when we did the certification and we created, our framework, and any big company, you have to do that, right, to keep it sustainable. And I don't mean it to sound cliche, right? But, you have to do that so that you build sustainability and repeatability. And it really came down to a few very simple things. Simplifying finances, right? And I talked about the solutions and how we're simplifying there. Helping people manage their money. Leveraging experts, so that would be employees of the bank in our financial centers and our contact centers. Building the knowledge for our clients through education and giving them what they need to demystify, financial education and what it takes to properly manage our finances. And then really being there for our clients when they need the help in a whole variety of ways, Some clients want to interact with us in digital. Some clients want to walk into a financial center. So, getting that help when needed is really critical, and that's the foundation. A few things I would just mention in terms of shifts in these categories. So, we have a very robust platform for education that we use across all of our channels called Better Money Habits. And I equate this. I actually remember when I was coming out of college and I wanted to work in business, somebody gave me a very skinny, long book that was a definitional book around definitions in Wall Street. And that was my Bible for months. And that's kind of what Better Money Habits is, but presented in a much more user-friendly way. You don't have to carry it around with you. But it's a way to talk about some of the terminology that clients some clients just don't understand. So that Better Money Habit Foundation is really critical. Digital, obviously, for somebody like Bank of America and all of you, that really is an advantage for the consumer because it enables you to scale how you want to communicate with them, how you want to give them information. Digital, obviously, during the pandemic was a huge advantage and, I think really was accelerated because people saw that as an alternative to in-person, which unfortunately was not possible in many cases. So, the other things I would mention are, the reinvestment in our communities. We have at Bank of America, a very big focus around operating our physical footprint in our local communities and really look to balance about 30% of our financial centers in LMI neighborhoods. We have very specific training in our community centers. We are very focused on having multilingual associates in neighborhoods where that is required and needed for our clients. So, really delivering to clients in a way that's meaningful to them. That is really what we're striving to do as a large company, is delivering very personally across that network of 4,000 financial centers. Also from a financial health perspective, we partner with Operation Hope. And that is growing for us to really meet our clients where they are and give them amazing credit counseling and assistance and support. So, we are not shy to partner with organizations where that's their expertise and bring them in and allow our clients to benefit from that expertise. So I expect that partnership will grow as we move forward. So there are a whole variety of things that underpin, the 5 pillars of financial health, but those are a few of the really critical components.
I love hearing about the partnerships, about, it's so important to think about your employees and how they impact the work that you're able to do in your community and with your customers, in addition to their own financial health. So that's really wonderful to hear. Recently, the bank announced several changes to products and services really designed to impact and improve financial health. Overdraft reform being one of them, even more recently, zero-down mortgages. How have you, can you tell us more about some of these initiatives, and have you seen any results yet from them?
Sure. Yes. So I'll hit on overdraft first, because that, while we have made a lot of recent announcements about that, it really has been a journey for us over the last decade. You go back to 2010 and we made, our first really big installment on reform in the space for our company was making the decision to not allow point of sale overdraft, which really eliminates, the $40 cup of coffee. And so and we don't allow people to opt into it. I was not in the business at the time, so I can't take credit for it. Sure. But that was a very big decision for us, but one that we felt was foundational to where we wanted to go. And then over the course of the decade, we made some very big moves in really 3 categories. Our solution set, and I talked earlier about the essential solutions and creating low-cost, transparent, easy-to-use solutions. So we made some installments there. We made installments around financial education for our client. And then we knew we had to make some changes to our own policies and procedures and how we also interacted with clients. And in the category of simple solutions, we have Safe Balance, which is a no overdraft account. That was launched in 2014. We've made a lot of changes. We've taken a lot of client feedback on how that account works, And now it's the leading account that's opened by new clients. So it accounts for over 40% of new deposit or checking accounts that are opened at our company, which is a great sign. And so that's complemented by a couple of other really critical elements. Balance Connect, which allows you to attach different accounts and cover overdraft. And then Balance Assist, which is our low-cost, short-term liquidity option, $500 loan for 3 months for $5.
That's amazing.
So we felt the combination of that really gave clients good options to manage short-term liquidity. So that was one, and that certainly evolved and will continue to evolve, but we have a very good foundation there. And then in the way of financial education, we have better money habits. We also did training across our company. So we have about 60,000 people in our consumer business, and training them to interact with clients, educate, share information as appropriate. Not all the time, but when it's appropriate, they need to advise and share that information with clients. So that was two. And then finally, it was our own policies and how we apply fees. And so this year in 2022, I think we made the biggest moves in terms of eliminating the non-sufficient funds fee. We eliminated the Balance Connect fee, so that was $12. And then we reduced the overdraft fee from $35 to $10. And what I will tell you is there was a lot of discussion around the reduction in the fee versus the elimination of the fee. And, we obviously still watch, but we felt it was critical. We heard from clients that they want access to overdraft as an occasional service. So we felt, based on what we'd heard from clients, that we wanted to maintain that as an option for them at a lower cost. So that was really the balancing act that we were trying to strike. And, the feedback from clients certainly has been good. We've seen lower call volume from people calling in on overdraft fees. Certainly $10 feels less punitive than $35. And we've continued to allow clients to overdraft on an occasional basis. So the feedback's good so far, but we're still only a few months into the major changes. So we'll continue to watch it and certainly adjust as we move forward. So that would be one thing I'd share. The second, you mentioned the no down payment. There's certainly been a lot of discussion here, but we have a very big commitment to affordable lending and helping our clients get into homes. And so we made a $15 billion commitment a few years ago. We're just shy of $10 billion of lending towards that commitment. The program that we announced really was focused on first-time home buyers, right? And supporting them as they purchase homes, just like our existing programs. And it actually is, there is a down payment, but the borrower gets it through a grant from the bank. So there is immediate equity in the home that they purchase, which is a good sign, right? And I think that, as you go through the crisis, you certainly learn. So we knew that as we are lending to first-time home buyers, we wanted them to have equity in their home. So that's how we enabled, we're enabling it through the grant. And then, certainly making sure the borrowers have the ability to repay. Every single loan is underwritten, and we look at that. Nobody wants to put someone in a home that they do not have an ability to repay. So that would be component number 2. And then 3, financial education. So anyone coming through this program actually has to have credit counseling so that they're prepared with the skills and the knowledge they need once they get into the home. So, we do stand by, what we're doing in this space, and I think it's good for borrowers. It is, good for the neighborhoods where they're purchasing the homes. And, we continue to have a very big commitment to consumers to enable them to buy their first home in a responsible way. So this is all done in the context of our responsible growth strategy.
That's great. So you obviously have so much going on related to financial health within the organization. You recently received the J.D. Power Financial Health Certification. What's next?
What's next? Continuing to grow our focus on financial health because it always evolves, right? The economy will change, topics that consumers want to talk about will change, and we need to evolve with that. So that is certainly number one, making sure we have our fingers on the pulse of how the market dynamic is changing and expectations of consumers change. Two, I would say, is delivering a personalized experience to our consumer clients. 60 million clients, you have 60 million profiles. Everyone is unique, and that's really where we want clients to feel that they have a unique relationship with us, and it is a two-way relationship. We have a whole host of tools. We're building out Life Plan, which is an ability for our clients to plan for themselves. That's enabled in digital, which, again, I know I spoke to digital earlier, but that's a huge advantage for our clients because it enables them to empower themselves, and so we'll continue to build that out as well. I would also mention that, security is top on my mind for our consumers. Bad actors are out there. They are getting more and more sophisticated. So really protecting our consumer client, educating them on what to look out for is top of mind for me. We deployed a tool called Security Center, which is a way to gauge the health of your own security, right? Multi-factor authentication, passwords, and it gives you literally a checklist. I don't know if anyone likes a checklist. I love a checklist.
I love a checklist.
And so that provides a checklist for clients so that they know how do I protect myself. So we'll continue to evolve that because that landscape is always changing, and it is it's critical for the consumer client to understand how to protect themselves, and as their bank, we want to protect them as well. So there are a lot of things that I think are really exciting in the financial health space. There's so much more we can do with it, but delivering that personalized experience in a way that makes our clients feel like we've got their back from a financial health perspective is really, that's the end game.
That's wonderful. Well, thank you, Holly. It's been a real pleasure.
Thank you.
And thank you all for being here.